Okay, and do you want to take us live? Excellent. So we're now live. Welcome everyone to the South West London CCG Governing Body meeting. Particular welcome to Millie Banerjee, who's joining us this morning. She's the Integrated Care System Chair. As most of you will know, the CCG will cease to exist and the ICS will take on those statutory responsibilities. That was due to happen at the end of March, but is now delayed until the end of June, so the 1st of July. But increasingly we're starting to operate in shadow form as a system, so really welcome to have Millie here as part of this meeting and the discussion. So welcome to Millie, particularly welcome to everyone else. I won't do a round of introductions. What we'll do is we'll get people to introduce themselves as they go. I've got apologies from Ian Dodds, Director of Children's Services, and Julius Parker, who's the CEO of Surrey and Sussex LMCs. So the meeting is being broadcast live and it's going to be uploaded onto the South West London CCG website as well. Members of the public will be able to ask questions and then we'll do our best to answer them at the end of the agenda in the allotted time then. So I will just note that we've got the declarations of interest for members. That's included in everyone's papers, and all papers and presentations are going to be taken as read. So I'm assuming people have had a chance to look at them before the meeting and to go through them in detail. What we will do is get the presenters to present really a high-level overview and just pick out the key features from those presentations, and then we'll try and devote as much time as possible to discussion and questions. So first item on the agenda is the declarations of interest. So can I just check with people that the declarations that people have made are accurate and up to date? Is that confirmed? Yes, good. And any particular interests people want to alert us to in relation to any of the items on the agenda? No? Okay, so let's go straight on then to the minutes of the last meeting that are dated 3rd of November. So let me just pull those up and I'll go through them page by page. So this is page 8 of your pack is the first page of the minutes. So page 8, page 9, page 10, page 11, page 12, page 13, and page 14, which is the last page of the minutes in your packs. We're happy that those are an accurate record of the meeting. Okay, I will take those as accurate. Let me just bring up my. I'm working purely electronically today, so I'm just flicking between screens. Let's go straight on then to the next item on the agenda, which is the Chair and Accountable Officer reports. So I will take this as read. You've got a report from me on improving kidney care, and then you've got 2 updates from Sarah, or rather 3 updates from Sarah, one on winter communications and the vaccination programme, an update on the ICS, and then vaccination as a condition of deployment for all healthcare workers. So we're taking it as read, but Sarah, I think you probably want to say something in addition to what's in that report. Is that correct, particularly on the vaccination issue?
Yes, so I'm going to take my part of the report as being read, apart from we have had an update to the vaccination as a condition of deployment, and we have had advice from NHS England that the Secretary of State is reconsidering the position on vaccination as a condition of deployment, and on that basis we have been advised not to issue notice to any of our staff. So we are continuing to talk to our staff and to stress the importance of vaccination and to ensure that we have a log of who is vaccinated and who isn't, but we won't be issuing any notices, and then we await further guidance from national team team and from Secretary of State, because obviously they'll have to take this through legislation as well. So that's the position currently, but we are obviously still supporting our staff. We're still trying to ensure that people are aware that they can have the vaccination, and that we're supporting them where we can to take that offer up.
Thank you, Sarah. Really helpful. So let me open it up for questions and comments. Paul, over to you.
Thank you, Chair. I just had one question on that, Sarah. Obviously, with the change in policy there, I was wondering if we're aware any members of staff have already resigned obviously thinking that this was becoming an issue come March, April, and whether there's a chance, therefore, to contact them, talk to them, and maybe they need to change their mind if they have resigned in advance.
So I'm not aware of any staff within the CCG that have resigned at all, and we were in a process of just talking to staff about the requirement and ensuring that we had their vaccination status. There may well be other people in the system that may have happened in one of our providers, but I'm not aware of that at the moment. I think the pause on giving notice, most people I think were waiting to see what happens and see whether or not they were going to be given notice or not. So I'm not aware of that. We definitely haven't within the CCG had anybody.
Sure. Okay, thank you.
Matthew, would you like to come in?
Yeah, just to follow on from what Sarah said, just for governing body members' information. So Sarah's right. From a provider perspective, we were preparing to send letters, but only after the 3rd of February, which was the day when the first dose would have been necessary to achieve double vaccination by 31st of March. So letters were being planned to go out on the 4th, and therefore we haven't sent those letters, obviously, because we haven't got to the 4th, and now we won't be sending those letters because we've been instructed not to, which obviously we will fulfil that requirement. In terms of resignations, as a consequence, the risk is low about resignations at this stage. I'm, along with Sarah, not aware of any specifics within my provider responsibilities of resignations. However, that may be that there are some in play that I'm not yet aware of. If that is the case, we are writing to all the affected staff anyway, saying to confirm what the situation now is, and if any of them had resigned, we were explicit on a call we had with staff yesterday that we of course would look very favourably and indeed be amenable to them rescinding said resignation and just returning without having a break in service or anything else, because obviously their notice period would not have completed. So I think on that particular issue, Paul, that is manageable. There's plenty of other bits to this which are challenging, but I think on that piece we can manage that okay.
Thanks, Matthew. That's helpful. Nicola, over to you.
So this will apply to providers as well, of course, but just in terms of us as a CCG and as an employer, Sarah, you mentioned the kind of log of the vaccination information, and I think we just need to be clear about the status of that now, because it won't be complete because we hadn't reached the deadline whereby staff had to submit that information. And I think that probably, but we need to confirm this, there'll be no requirement to now continue to collect that log, or is there? Just flagging it as an issue, because the basis for collecting information from staff and potentially new employees, etc., needs to be, quite clear, just to make sure.
Yeah. So where we are currently, we are legally allowed to collect that information, and that has not changed. So we will continue on that basis, because they haven't not yet changed the legislation. So we will need to do that in case the change isn't as we think it's going to be, if you see what I mean, Nicola. So we have to keep doing the right preparation. So we are legally required at the moment to do that, and we are allowed to do that. So we will continue until such time as we receive guidance or the legislation changes, and we haven't had that yet. The only guidance we have had currently is to not issue the letters of notice, and so that's the bit that we are no longer doing, but we are carrying on talking to our staff. I think it's really important that we're doing this in a supportive way, that we are actually stressing the importance of vaccination and supporting staff to get advice and a vaccination where they wish to. So we are carrying on that process. If the legislation changes, or if we are advised not to, then obviously we will change that, but that's the current status.
Thanks, Sarah. That's really helpful. I fully endorse what you said in your last few points. I think that's really, really important. Bruno.
Yeah, I presume, though, that you will be bringing an update to the next governing body meeting nonetheless, because I presume some kind of update will be required at that point too.
As soon as we have further information, yes, we can bring an update to the next governing body. If we are no longer required to take any action, then we'll bring that update. But yes, we will bring an update to the next meeting.
Thanks, Sarah. Any other questions about any elements of the report? No, so we're asked to note that. So thank you, noted. Let's go straight on then to item 5, which is a really important one, which is about the CAMS transformation plan. So Tonya, you're going to just give us a quick overview of the key parts of the report, and then we'll open it up to hopefully a really good discussion about this.
Thank you, Andrew, and I won't go through the actions in the plan as they're there for you, and I think hopefully for many members they will recognise the work that we're already doing in the CAMS space. So I'll just give you a bit of an overview of what the plan is. So the CAMS Local Transformation Plan for South West London describes the local vision, priorities and actions to address the emotional wellbeing and mental health needs of children and young people, together with support to their parents and carers. This is not a new plan, so we've had transforming CAM plans for a number of years, but the refresh was paused during the pandemic. Previous plans we produced on a borough basis, so we had 6 separate plans for South West London. This plan is one for the whole of the South West London system, with an opportunity for each borough to highlight the best practices. There are examples of best practice and specific issues, and you see that in the pack. So that's really important. This is the first time we've been able to bring together those common themes into a single plan. Just to note, the document is shorter than previous plans and aims to be more accessible. Its overarching aim is to consider ways to make it easier for children and young people to access help and support when needed, and to continue to improve how services are provided. The long-term plan has been developed to focus on promotion of resilience and prevention and early intervention, but it also addresses service boundaries, improved access through a system without tiers. I think I need to stress what it's not. It's not a strategy for children and young people's mental health, because it addresses key priorities at a national level. So it's quite prescriptive what the Transforming CAM plan should cover. So I just wanted to stress that to the members. But it does describe, as I say, progress against key priorities that are identified at a national level. In developing the plan, we've used the previous borough plans, and we've been informed by local engagement across each borough. The plan has been through health and wellbeing boards, but we also use the local borough networks for children and people. I would also stress that we don't engage on the plan itself. So we talk to young people about elements of the plan. So when we talk about the emotional wellbeing hubs in schools, we've done huge amounts of work with engagement with school children. And when we're looking at I Thrive in our boroughs, we will engage on that. And we also use our system-wide groups and the Mental Health Transformation Board. And just to say the next steps, so we drew up the plan during summer and autumn last year, and since then we've been engaging with partners on the plan, and we're just finishing the last phase of that engagement, and we'll reflect the feedback in the final published document. From the conversation with the team, there isn't any significant changes in the document, so I'm not expecting it to be very different to what you see now. And if everybody is happy to accept this as the final plan, pending those final amendments, which I'm assuming will be minor, we will then publish that as our CAMS transformation plan. But as you say, Andrew, happy to take any questions.
Thanks, Tonya. Really helpful. So I'll take Chair's prerogative to go first. As you know, I've got a huge interest in children and young people's mental health. I guess my first question, Tonya, was you asked whether we're happy to approve it. I've got in my pack that we're noting it, but maybe you could just clarify whether we're being asked to note it or to approve it. That would be a good starting point. Shall I come back to you on that first, and then I've just got a few questions on the detail of the report, and I'll then open it up.
Yeah, I think it's a bit in terms of governance from a national level. It's a bit, you just need to publish it. So I quite like the governing body to approve it, actually, because I think an endorsement from the governing body would be great, and we have to publish it on our website.
Excellent, good, thank you, Tony. That's really helpful. So can I just start by saying I thought it is a very accessible report. I think there's a huge amount in there. I like the way you've developed it very much with the boroughs involved, and it feels like a plan that reflects what's going on in the 6 boroughs, but it also gives an overarching view for the system. I think that's really well done, actually. 3 particular questions from me. One was on neurodevelopmental. So obviously in there you've got different approaches across the different boroughs, and I wondered whether we have learnt from that, whether there are better approaches in different boroughs, and whether that's going to inform a kind of Southwest London view on what should be best practice and whether that's potentially achievable. My next question was on eating disorders. So what I can see is there's a significant increase in referral numbers, and I'm just wondering how confident we can meet demand. I know there's a number of things in there, but what jumped out at me as well was that the acceptance rates had dropped from 80% to 53%. So I guess I just want some assurance that we're going to meet that increased demand by genuinely transforming the services, not by raising the thresholds for what is accepted and what isn't. So perhaps you could answer that one. And then my final one, and this may be picked up in your opening comments where you talked about this being a transformation plan in line with what we're being asked to report back on nationally, not the overarching strategy for CAMS, is the basic demand and capacity modelling for CAMS. What we can see in this report is that the numbers, we've got the numbers up to March 21. I'm assuming that the numbers might have gone up during this last year, and I think we're all assuming that there is a backlog and probably an increase in need amongst our young people on the basis of having been through COVID. So I just wonder how confident we are in projecting demand going forward and how well we're going to adapt services to meet that demand. So those were my kind of 3 areas of inquiry, but I can see a lot of hands. So let me go to everyone in turn, Tanya, and you'll be frantically scribbling, and maybe you can come back on some of the key themes that emerge. So I'm going to go in hand order. Susan, yours was up first.
Thank you. Yeah, thanks, Tonya. A massive amount of work, isn't there, going on? Absolutely fascinating to read all about it. One of the interesting things I read was an underrepresentation from ethnic minorities in accessing CAMS, and I wondered if you could, maybe this is for another time, but whether you'd be talking a bit more about how these plans will try and work to address these inequalities. So there are themes that run through the priorities that you're tackling. And you mentioned that the plans are obviously is a multi-agency approach, isn't it, to the child and the young person, and you've taken it through some of the local authority forum. I just wondered what this tends to look like an NHS investment plan against those priorities. Are there any risks around the way that other agencies are able to contribute in terms of delivering that, what the risk sort of factors are? And presumably the one big risk is the workforce that you have to help either transform, change or increase capacity to do some of this, and are those part of the bigger strategy rather than these priorities? Perhaps point me in the right direction of where I might see that. Thank you.
Thanks, Susan. Dagmar, let me come to you next.
Yeah, hi. So bit of borough perspective. So first of all, huge thank you. And there was really, at least I can speak for Merton, really good collaboration. So a big thank you. One of the themes picking up from Andrew, the eating disorders and also disordered eating, so not quite the full-blown thing, but something not quite right with the eating. We had it in the Health and Wellbeing Board together with our healthy weight refresh, because we've got a really toxic composition of really an increase in obesity and an increase in the
Dagmar, you've frozen for us. We got an increase in obesity. Let's pause that I'm going to go on to Pippa, and then when Dagmar comes back in, she can continue. So Pippa, over to you.
Okay, thanks, Chair. You'll see from the QPOT report that we were able to have a look at a slightly earlier version of this. So it was just a couple of comments and then a question, really. So I just wanted to make comment about some really good stuff that I can see in here and that was noted at QPOC. So I think that the ambitions or the intent around each of the areas is clear or clearer, and the neurodevelopment and eating disorders we did have a brief discussion on. It's really helpful to see the workforce and digital strategies, and I think because they're such key enablers to pretty much everything we do, I think as a model, as a governing body, whether that's some thought to be given to, where appropriate, we also have workforce and digital strategies supporting our transformation plans. And the other really positive thing was the co-design stuff. So we talked a lot about evaluating it. So there's lots of different models of care in here, and evaluating their effectiveness from a child-centred perspective, and you could see that in here, Tonya, so that comes across, I thought, quite strongly. The question for me at the end is, because there is so much in here and so many different plans and different elements to it, is what's the oversight going to look like? So how will we know where the risks are to the different plans, the different elements of it going forward, and where will that sit in the new architecture?
Thanks, Pippa. Good questions. Dagmar, looks like you're back in. Yeah,
I think let's just order. There's so many. So linked to childhood obesity and food poverty, stigma big time. So it really needs to engage very much locally on these sort of wider issues, feeding the big increase in some of the need.
Thanks, Dagmar. And then Liz.
Thanks. I think the questions from Healthwatch, several of them chime with what's already been said, and I think it's a recognition of just what a complex piece of work this is, and bringing together, as you were saying, Tonya, your 6 different boroughs. So I think because it's so complex, I think some of us would appreciate a bit more help, not in this meeting, but about what the main changes are from the previous provision. We'd also got the same questions about how it would be evaluated, because it's a complex collection of provision, and also about how some of the services relate to others, and whether there's a kind of overlap in terminology. And I think particularly in relation to prevention and I Thrive, what the boundary is, if indeed there is a boundary between those two, and also a bit more clarification about the boundary between tier 2 and tier 3, which has been a problem before, and we very much welcome that that gap will be bridged, but I think a bit more help to see how that will happen would be very useful. Like one of the earlier speakers, we wondered about how this will relate also to local authority services, and I know Susan mentioned that it felt fairly NHS focused at the moment, and therefore it would be very good to see how the local authority services also not merge, that isn't quite the right word, but coordinate with this. We also had that same big question about the demand modelling, so we'd really welcome, and that's a big question we recognise, but we'd welcome a response on that. And in relation to the public engagement, there were 1 or 2 places where we wondered about that, and whether that could be strengthened in the future, and in particular the citing of a couple of the wellbeing hubs was the one that was raised. I think Wandsworth raised about the citing of theirs, which wasn't actually in Wandsworth, and Richmond has raised the question about the siting of theirs, which is in Kingston, and they're particularly pointing out that, of course, young people will tend to be reliant on public transport to get to services, and therefore we probably need to be sort of ultra aware of accessibility for younger people, and particularly people who also have other challenging issues as well. Thanks.
Thanks, Liz. And I think probably because of the complexity of there is a kind of overarching question of how we engage with Healthwatch effectively about this. And I think you've got a load of questions there, many of them are of some detail. So I'll let maybe Tonya pick up some of the next steps around this. She might not be able to answer all the specifics in this meeting, but I think let's agree a way forward for how we do that work with Healthwatch particularly. Bruno, can I come to you?
Yeah, thank you, Andrew. Yeah, Tonya, it's a very comprehensive plan. My question is really around the what engagement there still remains to be done on it, because you're seeking approval or endorsement of it rather than simply noting. So I think it would be helpful to have a little bit of expansion on that. And I think that touches on what Andrew was just referring to about what Liz was saying, because I think that it's important that it's clear what engagement will have been done on this if it's going to be approved before this, or it's all completed, as it were.
Thanks, Bruno. And maybe, Tonya, you could just, in your response, I guess, flesh out some of the engagement that's happened to date, because from what Dagmar said, there's been a huge amount of borough-level engagement on this, which is quite encouraging to hear. Nicola, let me come to you.
Thank you. So it's packed full of important issues, isn't it? Really, really great content. And I do note the engagement with local boroughs, but I think as other people have commented, there's something about the NHS emphasis of this. And this is probably an issue of timing because our health and care plans have not yet been published. But I think this might be built on legacy kind of NHS local plans, and the way to really build in what's happening at a local level with local authorities and health watchers in all of that partnership is to make this reflect the the local health and care plans being brought together. And as I say, I think that's a timing issue, but I think we'll need to make sure that we take massive account of that in any refresh. And I hope that through the engagement that actually that's all built in. But everybody's mentioned children and young people's mental health in their health and care plans. So that's got to be a really important source of future refreshes of this.
Thanks, Nicola. Really, really good point. Karen, can I come to you?
Hi there. So Tonya, I think it's really helpful to see it all in one place, isn't it? Everything pulled together in such a clear way. So thank you for that. And I think you can tell by the number of questions the importance of the topic, can't you? I had four things. One was how we know we've been successful. So that whole kind of outcome metrics. I had a clarification question because it looks like a huge amount of work, and I think it only covers 21-22. And therefore, I suppose we'll almost be beginning the next version soon. And whether in future we want to bring the South West London and the national position together so that we look in one place for CAMS transformation. And then my final point was, again, there is a huge amount in here. Have we got the resource to be able to do it? Is the funding there? Is it possible that we're going to achieve all of these things? And if not, where you think the risks to achieving the strategy or the plan will be?
Thanks, Karen. And finally, let me come to Mark.
I think Nicola probably stole my thunder, but I think firstly it's great to see the boroughs represented in the plan and a kind of aggregate upwards into the South West London plan. But also I do think we've got a great opportunity with our refreshing of our health and care plans and our borough committees. They are partnership committees, so actually the conversations about are our partners involved. This is somewhere that we can really take that and embed it in the partnership, the new partnerships or the refreshed partnerships. So I think there's a real opportunity to kind of, in the ICS world, really make this owned at a local level.
Thank you, Mark. So, Tonya, I think some of the key themes to emerge there. One is ongoing engagement with boroughs, isn't it? So that this isn't just a one-off plan, but is continuing to be adapted as priorities emerge through the health and care planning process. And I guess to some extent as well, with really effective ongoing engagement with boroughs, you'd assume that Healthwatch is part of those conversations. So there's a key theme there. I think Karen's points around deliverability, but also how we demonstrate success and delivery is a really good one for you to pick up as well in your response. There's some questions of detail, and I'll leave it up to you in terms of how much you go into those. I think the overarching themes are really critical, though. Matthew, did you want to come in before I come to Tonya?
Yeah, sorry, Andrew, to be slightly after the other string of points. Just quickly for me, I mean, I think I would be endorsing this document. I think it's an excellent piece of work and really, really important. What I would say, and it's a little bit in the spirit of other comments made, although a bit more specific, which is this is going to be really helpful, important, valuable. And I think will make a difference if we're able to fulfil the sort of objectives in there effectively. But it's going to take time, and I think it is beholden on all of the governing body to note that we've also got immediate challenges today on the cannabis provision down the emergency care line as much as anywhere else, and I don't think we want to just say, well, we've got this piece of work, and if we do this over time, that's enough. We've also got to make it an objective for us to respond to the immediate issues that we have and work collectively with our mental health providers and other colleagues to ensure that the service that we now have as we speak is also more responsive to the needs that are definitely increasing in the way that we've all seen over the recent period. So I thought that was important just to add, Andrew.
Thanks, Matthew. And final comment from Agnello, and then Tonya, I am going to come to you.
Sorry, I mean, totally endorse the document. It is really excellent piece of work and everything that people have said. There are just two points from me. One as a referrer into services, and in the future, can we have surveys both of schools wearing a governing body of the school hat, as well as a GP hat in terms of referring into services? If we had a survey to show progress, would be really helpful, because this is, at the end of the day, we want to make a difference to people at the front line, and we can have all the plans and all the strategies, but if we don't really see some improvement and give some hope to parents and children, then we're not achieving our goals. And I think being able to have some real-time information would be really helpful, because I have feedback from schools, I have feedback from GPs, which doesn't always fit in with everything we talk about in terms of the plans and strategies that we got. So I think, how do we triangulate the experience at the front line with what we're doing?
Thanks, Agnew. I think that's a really good question. I guess it builds into how do we measure success, doesn't it? Which was Karen's point, and that needs to be quite a broad measurement. So not just hard metrics, but also some of the softer stuff that comes from, as you say, service users and referrers into the services. So, Tonya, I am going to come to you now.
Thanks, Andrew, and thank you for all your thoughtful questions and really important and relevant. I think I just wanted to say a couple of clarifying things. So the Transforming CAMS plan in itself is limited because it's about the funding the NHS gets to, local NHS gets to support transforming of children mental health services. So it's very specific. This is our evidence that we're using the money in the way that it has been asked for to do nationally and regionally. So in its scope, it's very limited. That's why I wanted to stress this is not a strategy for CAMS services. This is how are we addressing those national priorities that have been identified using the money that has come through to the local NHS. So that in itself puts some parameters around what the plan is. Saying that, I know that many of you will be aware that we are starting on development journey for our mental health strategy for South West London that will have a strong children and young people's element to it, and that will build on things like how do we do the modelling. So you're absolutely right, it's on a year's plan. It's asking us what have we done in the year, what we plan, what we've done using the transformation money. But the strategy will also be much more looking forward, and we will do things like modelling. And I think actually now, having come out of the pandemic more, we will, and we were talking yesterday about the launch of the strategy, we'll be absolutely able to be out more robust modelling about the impact. So I think those are the things I would say. It'll be a triangulation, I think, between this, the mental health strategy, and then local health and care plans that will bring together the richness of what we're doing to support children and young people in this area. What I would also say, there's nothing new in the plan. So this is work that is already in train. So we're not asking people to do additional on above of what they're already doing. This is what's happening in places at system and in providers. So actually there is something around always looking at the capacity to do this. But I would also say we're not asking people to do more in that. If I go through some of the specifics, I'm sorry if I forget some of them, but you're absolutely right about neurodevelopment, Andrew, and I spoke to Gloria last week about how do we do a piece of work across South West London that brings together the experiences at a borough and local level on neurodevelopment pathways, what's working, what's not working, because neurodevelopment cuts across many of our work streams across South West London, children, young people, learning disabilities and mental health. So we are starting to look at that piece. The eating disorders, I'd need to go back and get a bit more detail, which I'll follow up with you, Andrew, afterwards. But you're absolutely right. We need to make sure that the thresholds for treatment they don't continue to get lower and lower because the referrals have gone up. And we're looking at other models such as FREED, which is community-based support to people with eating disorders. We talked about the capacity modelling. I think we'll get some really good capacity modelling and look forward and demand through our strategy work. And also our strategy will address things like health inequalities, Susan, about how do we make sure that all our services, including children and people, mental health, has the representation from all our population groups. So we'll absolutely look at that, and again also with the workforce there as well. The strategy will pick up the workforce. In terms of Pippa's question around oversight, absolutely, as part of the formation of the ICS, we will develop delivery plans of which children and people's mental health actions will be part of that, and we need to map who is responsible which part. So I think having those borough sheets we can see for those boroughs, that will be part of their delivery plan, and that's where we will be looking to achievement. The Mental Health Transformation Board will bring that narrative from each of the different parts of the system together into a single narrative to share through our system. Talking to Health Watch, absolutely, Liz and Bruno, if you've got any standing meetings, it would be useful for us to come and talk to you in more detail around CAM's plans. We can do that, and I'll pick that up with colleagues outside. I think the engagement on the plan itself, Bruno, I think it's really important to say that this is ongoing work. So we wouldn't necessarily, I'm conscious that we wouldn't necessarily engage on the plan, because we engage on parts of the plan and the work that we're doing, and we build that into the plan. So I think we've engaged on elements of the plan, and we continue, because this is a annual plan, and we've talked about some of the work we've done already in schools. And I know when we did Kingston and Richmond, when they looked at the iThrive model, there was quite a lot of work with young people in those two boroughs to think about what that model could look like. So we would, rather than go and talk to, here's a CAMS transformation plan, can we talk to you about it, we would want to talk about elements of it. And of course, through the strategy work, we will continue to engage. And I think the outcomes, and I think the evaluation is really important, but I think it's also quite challenging. What intervention or range of interventions prevents someone from, or a young person from having a mental health illness is quite challenging, difficult to evaluate. But we will evaluate, and we will look at how we can really identify those interventions that are the that have the most impact for our young people. And also looking at, as part of the strategy, we'll also look at best models elsewhere outside South West London that actually have the impact, and particularly as we've talked about neurodevelopment, that would be one area that I'd be wanting to look at best practice as well. I think I've covered most of the points raised. I'm sorry again if I've missed anything. I absolutely thank you for your support of this plan, and actually thank you for the questions, because they really were insightful. I think, as you say, this is a really important plan. It is a plank of a overall children and people's mental health plan that we are developing, and I look forward to being able to come back and talking to you about our progress in due course. Thank you.
Thanks, Tanya. You did a good job there of responding to a whole range of different comments. Can I just check with board members, anything further? So any people's questions or concerns that weren't adequately covered in Tanya's response there that you just want to flag up again? No? Patrick?
Yeah, so just on the recruitment and retention of staff, which Pip raised, is there a national plan for this? Because I don't think we are alone in struggling to recruit and retain staff in this area.
It's a topic of conversation all the time, Patrick, at a regional, national and local level about workforce and how we look at different models of workforce and different skill sets. So you're absolutely right. Everyone will recognise, particularly for some of our specialist pathways as well, it's a real challenge. So how do we develop our workforce? Different skill sets, different models is going to be a hot topic as we go forward.
Thanks, Tanya. So now I'm going to come to the board. We were asked to note it. We're also asked to endorse it. Personally, I'm happy to endorse it because I think, as we've noted, there's a huge amount in there, some really good, ambitious plans. And can I check though with the board? Is that a shared view? Lots of nods from those I can see. Some thumbs up. Good. So look, Tanya, we've noted it, but we've also endorsed it, and really good piece of work. Thank you very much. Right, I'm going to move us on to the planning guidance. So, Jonathan, over to you.
Thank you very much, Andrew. So we received our usual gift from NHS England on Christmas Eve of the planning guides for the forthcoming financial year. That guidance was launched right at the heart of the peak of the Omicron wave. So the guidance reflected that and noted some of the timelines might change, but I suspect they will stay as outlined there, which requires initial submissions of our plans for 22-23 by the end or by mid-March, and final submissions by the end of April. Of course, we'll be building on our submissions for the last 6 months, or H2 as we've called them, of this current financial year into the new planning round, because that process only concluded in November. The deck before you in the papers goes through the key priority areas. So just to briefly touch on those 10 areas, and I'm sure they'll be familiar to people, but just so people are clear what they are. As we've already touched on in the previous item, the scale of the workforce challenges we face around gaps in key areas, as well as demonstrating compassionate leadership at this time, and addressing diversity is a key priority area. We're continuing to respond to COVID, not only in terms of the vaccination programme, but beyond that, thinking about the million or more people with long COVID symptoms. A big step up in elective activity and diagnostic and outpatient activity. So planning to deliver 110% of what we delivered pre-pandemic on elective and outpatient pathways, and 120% on diagnostics. Perfectly understandable in the context of the scale of backlog, 6 million people waiting nationally for access to care, but a significant challenge in the context of the first point around workforce. a step change actually in how we deliver urgent and emergency care as well, with more hospital inpatient beds sought, and a change in what we deliver around virtual hospital and virtual ward care, building significant additional capacity in that space, so that we can make further inroads to eliminating long waits for patients and delays in hospital handover. Continuing to invest in primary care and supporting the development of primary care networks and new posts that we plan to put in the system. Mental health and learning disability, making our commitments around mental health investment and further expanding community services, delivering more on population health management and understanding the needs and health inequalities that we need to address as a system, making further inroads to 2025 around the digital strategy, delivering more productivity from a financial perspective, and then of course establishing the ICS, and this is the document that outlined the new timeline for the 1st of July for the birth of the ICBs in systems. So that's a very brief summary of what's set out in the 30 odd pages of planning guidance. We expect a lot more detail to emerge through the next couple of weeks, really. The paper sets out the timeline, noting the importance of this board and indeed of the Recovery and Transition Board in the system, with the key dates which we'll be working to. And the slides also set out the approach we've been taking in January. It's one of sort of developing the right strategy with the planning leads. We've intentionally tried not to draw too many operational leads into this through January, given the immense pressures people have been under in January, but ratcheting up the pace through February as we begin to work through some of the detail of what we need to deliver. So we've got clear-cut plans come March and April, and the paper sets out the role of the planning coordination group that we're going to put in place, the planning and prioritisation group to make some investment decisions, FAC, the Financial Activity Committee, etc. And also notes that one of the things we built in as a new idea into the previous planning cycle would be meetings with trust, finance, workforce and operational directors at a late stage in the process, just to ensure we were completely triangulated around those key indicators. And we're going to continue to build that into this. And if you ask me what's the one big challenge, I think it's going to be that, because the scale of ambition in this document is very significant. And if you balance that with the workforce issues the system faces and the financial context, which is going to be increasingly challenging into 22-23, I think that sort of outlines the scale of the ambition that we need to deliver against. So the paper then goes through some more detail against those 10-point areas. And really, Andrew, it's a sort of entree just to note for the board that the planning round is now underway, and of course we'll keep people updated over the next month or two as those plans are refined and developed. So that will be it in a nutshell.
Thanks, Jonathan. And this is for discussion and noting at this point, isn't it?
Indeed, yes.
So before I open it up to questions, I think I've got Sarah and James wanting to come in, presumably to supplement what you've said. So Sarah, can I bring you in first?
Yes. So firstly, all I was going to say was that it's very clear that this is a planning round that has been brought forward from a pandemic. I think that's really important to note, because it's really focused on the recovery and ensuring that it's really challenging around things like elective care, but it's less detailed on some of the more strategic things that we would do as a system, such as workforce and digital and those kind of areas. So what I would suggest is that even though it's challenging in some areas, it's a minimum in other areas. So we will be doing more work than is set out in the actual planning documentation. But I think it is worth recognising that this is a slightly different planning round to the ones that we've had in the past, because we are just kind of of emerging from a pandemic, and we are trying to support our staff and get ourselves into a good place, rather than focusing on trying to do a massive transformation at this point. I do think that's really quite important. The second point I was going to make is that we have, as others have, struggled to kind of triangulate that activity, finance and workforce together, and it's a difficult thing to do because we haven't worked in that way historically, I think, in the NHS. We have been offered some additional support by the national team and NHS London in order to support us with that planning ask. So we will be getting some additional support, and we met with London region yesterday with EY, who have been I think procured by the national team in order to support us in that work, and we're just setting out the terms of reference and scope of that work as we go forwards. So we will have some additional support, not just for this planning round, but for the next few years to help us with that planning. So I think that's just an important thing to note for the governing body.
Thanks, Sarah. And James, do you want to come in?
Yeah, I think just to build on Jonathan's points really around the ambition against the money. So we're entering a new financial year, and soon we have a new financial challenge. So obviously we will be getting more money than we would have previously got under long-term planning assumptions, but we'll get less than we're spending at the moment. And as Jonathan's highlighted, there is a greater ambition with that. So we're facing a planning round with a completely different challenge. It's the right challenge because we do need to get back to where we were in terms of productivity and efficiency, but it is going to be a very different sort of leadership challenge for us and the rest of the system to get everybody into that staff. And picking up what Sarah said, given what staff have been through for the last sort of 2 years, we need to be cognizant of that fact that this is a big shift, and there is a slight difference in the reality of public messaging to what the numbers are telling us where we are at the moment. So I don't want anybody to become misled that there's a lot of ambition and there's a lot of extra money to back that up. It's more about how we get back to focusing on our productivity value for money as we come out of the pandemic, and it's the pace of change that we can do turn around to achieve that that's going to be really critical on that. So it's going to be a challenge for us all. I think we're in a good position as a system to kind of embrace that challenge, but it isn't going to be easy, and we're going to be doing that while we're going through clearly a structural change. And as Jonathan said, I'm trying to work out from a financial point of view how we have 3 months of a CCG and 9 months of an ICS and all the practicalities that come about with that. So I just wanted to make that point, Andrew. So just to back up what Sarah and Jonathan have said.
Thanks, James. Really helpful. And it is complex, isn't it? I guess my opening question, and I will open it up and take a range of questions, Jonathan, is if you want to scribble away and then you can come back in the round. Obviously you've set out the different areas there. What isn't clear at this point, just because of the high level nature of the report, is which of those are a bit more kind of business as usual that aren't a surprise and that we're on anyway, and which of those are areas that will be even more of a challenge for us as a system because we've either not got the teams in place or we're not used to putting so much focus on some of those particular areas that need to be incorporated in the plan. And I'm sure that will come into the conversation you're having with London about where we deploy the external support. But there's also something as well, isn't there, about what that then means for our functional review. So have we got the right functions to deliver that as a system going forward? And I guess the one on my mind is population health, which I think is really come to the fore in the ask around developing the ICS and putting the infrastructure in place to support that. So I guess it would be helpful just to get a sense of, or just to know that you've got that sense of how far away from being able to deliver these things we are in the different domains. But let me bring in the range of questions, and then I'll let you come back in the round. So Liz, do you want to go next?
Thanks for that. I noticed that the detail is going to be added then this month, and appreciate that it seems a very tight timescale. But the question that Health Watchers have asked me to ask is about the possibilities for public and patient involvement in fleshing out what will be done locally, and I guess also drawing on existing data from service users, and particularly health watchers would be involved in, interested in being involved in that. In relation to the population health, that would seem a very useful one that health watchers would be keen to be involved in. And I also wondered what work that has been done and will be done with the local directors of public health in relation to population health.
Thanks, Liz. Naz, do you want to come in?
Yeah, thank you. I'm not going to reiterate how challenging this is, but there is one area that I would just pick out that we really need to make sure that we've got the right infrastructure, and I'm pretty sure that we will have, is around the virtual wards, because it's not about early discharge, it's actually seeing and keeping patients in the community who would have otherwise been in beds within the trusts themselves. So it's actually making sure that we've got very good views on how we're going to tackle this at the South West London level, and whether it needs to be something across the system. And also we need the infrastructure to be able to help deliver it at a local system as well. So infrastructure where you're talking about workforce, digital management, etc. So I've only highlighted one bit, but there are several areas which are going to need an awful lot of support going forward on this.
Thanks, Naz. And Pippa?
So I'll just be quick because Naz has stole my thunder. The issue for me was not an issue. The comment, and it'd be good to hear Jonathan's response to you, Andrew, on where he thinks the gaps are. But the bit I thought we potentially needed more information on was the out of hospital offer and what that looks like, and what our plans are to develop that. Because many of this we've had many conversations about, and I am confident there are plans in place. But that one, I know there's work in progress, but following through on this, it might be an area we need to do more work on, and how digital and workforce is going to support that. And the only other comment was around how we're engaging the local authorities around our next stages to this, because they're key to some of the issues around discharges and community care packages and various other things.
Thanks, Pippa. Bruno?
Yeah, just picking up on what Liz was saying about public and patient involvement, I presume that the plans themselves will outline the kind of role that public and patient involvement will, including, and I'm thinking of the plans around population health management, because it's an integral kind of factor within that, and addressing inequality, and likewise digital. So I presume that the plans as they are developed will include specific reference to how public and patient involvement will inform progress going forward.
Thanks, Bruno. Dagmar?
Hi, yeah. So with regards to population health management, really important to use the local partnerships, local borough partnerships. That's where it really will bear fruit, particularly on inequalities. The 2 points I wanted to make is living well with COVID, Jonathan. So we are obviously also really thinking, what does the crystal ball tells us? And that is the tricky bit. But surge capacity has been one of the biggest challenges, and that made our response really jerky. You know, Omicron goes up, we need to stand up all sorts of services and hence park others. What are we planning long term on surge capacity? And the other one is around IPC. Infection prevention and control. We, with our conf money, have actually invested big time in infection prevention and control, but the money stops. We want not to lose it all. So how can we hold on to some of the good stuff, but really jointly with the NHS? So 2 things: living well with COVID for the longer term, to consider.
Thanks, Dagmar. And now, as we've gone through, hands have gone up from the exec team, so I'm assuming they're going to come back on some of the specifics, Jonathan, before I come to you for the comprehensive response. So let me go to Sarah next.
Yeah, so, and I'm sure Tonya has got a hand up to add to what I'm going to say. So just on 2 points, one area that I would say we definitely know that we need to do more work is around workforce. It's an area that I think through the 2012 Act went up nationally, and we don't have the same level of oversight of the workforce or the data and understanding of what's going on in the workforce that we had in the past, and we're trying to rebuild that now. So part of the ask that we will be making through this planning support that we will get from the national team will be around workforce, and particularly around how we measure that and actually get some standardisation across London on that, because that is quite difficult. The second area I was going to bring up was the virtual wards. I've actually queried this up to London region and to national, because I think the volumes are very, very high, that the requirement is 600 to 800 beds in South West London, which and there's a very tight scope for these beds, because they are kind of acute type beds. We can't count a lot of things in it, which we would normally say, yes, we would count that as virtual, such as pulse oximetry. So I'm querying whether those numbers are right. That's the first thing. But secondly, regardless of the numbers, what we know about these beds is that they require a huge amount of clinical support. So nobody will use those beds unless they have real confidence that they are the right type of beds and that they are working appropriately. So we have a big job to do around this, I think, to gain clinical confidence in the virtual beds and ensure that they are used appropriately. Otherwise, we're in danger of putting a lot of investment into something that won't actually get used. So I just thought I'd highlight those two areas, Andrew. And I'm sure Tonya's going to talk about the out of hospital work she's leading for us.
Tonya, are you?
Yeah, I'll just build on the virtual ward though. I just want to assure the board that we have started the programme, and actually Matthew and I are joint SROs for the programme, but we just need to take it to the next phase, and we will be doing some engagement where we're coming to talk to. I know we've talked about coming to the CLG, Andrew, the clinical leadership group, to talk about the update. So just to assure that there is a programme, it's engaging at a local level, there is resourcing, take away the piece that Sarah said around the target, there is resourcing being made available nationally, and we have been using that to start to kickstart our model, building on what we've already had in place, but recognise the challenges that Sarah has said. The same would be for the out of hospital discharge work. So we have a whole programme that we are running and developing. That virtual ward is part of that, because virtual ward absolutely supports discharge, but there is more, particularly around, as you said, residential homes and care packages, and making sure that our processes around our simple discharges are robust as well. And we meet with the discharge leads from each system fortnightly to go through their plans, and we accelerate that at points of surge. And I've got a meeting with them tonight where we'll be focusing on how do we reduce the number of 7, 14-day and 21-day length of stay. What actions do we need to do? So just wanted to give that assurance that the work is going. What I've taken away from this is that we need to probably highlight some of this work more throughout our system. So I'll work with colleagues around how we do that.
Thanks, Tonya. Gloria?
Yes, I've got 2 points I want to make. The first one is in relation to population health management and the link into health inequalities. I think one of the specific acts in the planning priorities is the concentration on core 20+5 within the system, which we've worked a lot on from the system-wide point of view. And also what we want to do is to then make sure that we show full representation of what happened in each of the places. That's one of the reports is going to keep up hopefully next week in terms of what the system overview of that looks like. Then secondly is to talk about that we've not really mentioned maternity at all in terms of part of the planning priorities. Maternity is going to be crucial as we move forward, as we are expecting Hawkindale report 2 to be out, and that is, we've got early indication that the report is going to be asking for more, because it's not still looking good in terms of improvement in maternity across the country. So just to say, maternity is going to be part of the priorities going forward. Thank you.
Thanks, Gloria. Matthew?
Thanks, Andrew. Yeah, I was just coming back on the virtual ward piece, just a couple of extra points to those that Sarah and Tonya's made. Really looking forward to working with Tonya on that, building a little bit on the work that we've done in Croydon, where we have quite a comprehensive and well-developed virtual ward service. And talking to Sarah's point about the scale of that, I'd agree. I mean, we're sitting with around 50 slots available here on the basis that, you know, we're a quarter of the population. That doesn't quite equal 600 to 800 across southwest London. Now, that's not to say that we can't push, and we will push to do more. I think there's real opportunities in this. I think it's an excellent idea and one that could make a real contribution both for patients and the system as a whole. But we've also got to make sure we're not setting ourselves up to fail by agreeing something that is just not practical or appropriate. But, you know, that's perhaps one of the first bits of work that Tonya and I will get involved in as we start this piece of important work off. So just thought that'd be helpful, Andrew.
Thanks, Matthew. And Karen?
So I was just going to point out kind of an obvious point, really, which is the workforce challenge cannot be underestimated, can it? So we have a really challenging planning round. We have workforce and people that have been working with patients and their families to care for them during the various waves of the pandemic, and they're tired. In addition, we've had the impact in terms of motivation on the vaccination as a condition of deployment, and therefore both of those things might put retention at a real risk, and therefore we've got a collective challenge on our hands. And I think we have to be really realistic about the workforce plans that we put in place. Last year we had a more optimistic look, I think, and actually we failed on some of those things because our workforce plans weren't strong. As Sarah said, it's a developing need for us as we go forward. But we need to develop workforce plans that are real, that are not what the money can buy. And I think that's going to be really, really challenging this year because, as James outlined earlier, the ask is higher and the money is slightly lower. So actually managing all of those and thinking about that integrated planning of workforce activity and finance is going to be a significant challenge. So we welcome the extra help that that the national team have procured to try and get that much more realistic in terms of moving forward. And I would just say that what we do and how we make staff feel every day is going to be the biggest challenge, I think, and that's the role of management and organisations going forward. And then finally, I think supply is going to be a continual challenge. It's not something we're going to be able to fix overnight, but it also gives us some challenges to be really innovative, and by using different ways of looking and finding and developing and training people, we also have the opportunity to reduce health inequalities and unemployment in South West London. So I think we have a mixture of opportunity and challenge, but it is a real challenge that we have this year and as we face the next few, I think.
Thanks, Karen. Really good comments. I totally agree with what you said. I think the whole range of different questions and comments was really impressive, actually. So, Jonathan, coming to you to respond to that array of feedback.
Well, it certainly was an array, wasn't it, Andrew? And that emphasises the breadth of what is set out in the planning guides and to my opening comments on the scale of challenge. So just to pick up some of the issues, and this probably echoes what people have said, but if you ask me for the 4 areas that stand out for me in the guidance around work, clearly all 10 sections have profound challenges for us. I would want to flag that, but the 4 that stand out for me is the workforce piece, and we talked at some length about the resources that hopefully we'll be able to use from the national team, both across London and locally, to help that, because that is an area that we do need to develop our planning approach to, and in fact our delivery approach to as well. So that would be one area. I think the elective challenge is really significant, partly driven by the workforce challenge, but to ask the NHS to do more than it did pre-pandemic is obviously the right thing to do in the context of the long waiting lists that we face, but is a really significant challenge. The virtual ward piece that a number of colleagues have talked about, some of the clinical cultural changes that are going to be needed to drive some of that as well, I think is a real challenge. And then there's also thinking forward and thinking strategically, and to your point, Andrew, about population health management, what more we can do there, which Gloria's also talked around the core 20+5 and the health inequalities piece is going to be key. So those would be the 4 areas I would pull out. I probably won't do justice to everyone's comments that we got. So if there are things I don't, then please colleagues feel free to talk to me outside. But just in some areas, whilst this is a really challenging planning ask, there are some things, to Sarah's opening comment, where we want to set a higher stretch ambition. So, for example, against the patients have waited 2 years, 104 weeks for access. We've already eliminated those in South West London. So I think we need to set a higher bar for ourselves into this 22-23 planning round. So I think we do need to think where we can go further, as well as acknowledging the scale of the ask. The process, it's not in these papers, but the process and each area has been aligned to one of the executive directors in the team. So colleagues should be thinking through what can be achieved in each of those areas. And I've also cut the matrix by place and provider collaborative to and system to sort of identify who needs to be critically involved in each element of the process. So we have that available. To the comments about public and patient engagement, well, I've already been to the clinical, patient steering group, the community steering group, to talk them through how we're going to be working through our plans over the next 2 months. I'm very happy to go back there, but that has representation from Health Watch across the board and other patient representatives too. So happy to go there and talk about that. And I'm sure we can pick up Bruno's points about population health management in that space. I think Dagmar's comments about living with COVID and the IPC implications, then again we'll be picking those up through the relevant work programme over the coming period too. Gloria's right, maternity is mentioned in the slides, and the Ockenden and second subsequent report, so we're going to need to build that into our thinking as well as we work forward. So a lot to do, some significant challenges, some areas where we need to think about what our additional stretch is as a system, and very happy to and will be coming back to update the board on progress on that as we work through some of those critical challenges and what I see as the overarching task of trying to square the people issues, the workforce issues with the financial issues, and the different context James has set out around that, with what we need to do to deliver the scale of ambition here. So Andrew, I don't know whether I've done justice to that, but I've at least had a go at doing so.
I think you did a fabulous job, Jonathan, of responding to what was a really broad range of questions and challenges. So well done, thank you. And I think, yeah, obviously we'll want to just be kept abreast of where things are at as we develop the plans further. So thank you very much for that. So we will note that. I think we had a really helpful discussion there as part of that item as well. So thank you. Let's go straight on to item 7, which is the detailed scheme of delegation. So there's some proposals to change that. And James, you're going to talk us through this.
Very briefly, we can try and catch up on this one, Andrew. People will be pleased to know I'm not going to try and spend 15 minutes on this. So annually, we have to review our scheme of delegation, which we've done. There are a few changes, mainly around the appropriateness of a couple of levels of approval for the size of organisation, and also to reflect some post-Brexit changes that we needed to do. This was approved by Finance Committee and Audit Committee before Christmas, Andrew. So it's really just bringing this to this committee to get final sign off. So that's all I propose to present, but happy to take any questions.
Thank you, James. And David, shall I just come to you, because obviously then as Chair of Finance Committee you've had a discussion, and maybe Paul as Chair of Audit Committee, if it's been through there, do you want to just confirm your approval of this in those committees, and were there any particular points of discussion that we should be cited on as a board?
Thank you, Andrew. No, it's been through Finance Committee. We've signed this off. We're happy with that. Some of this is just tying up some of the levels really to make so that we've got actually a smoother process going through. But no, there's nothing in particular I wanted to raise with the board.
Thanks, David. And Paul, as Chair of Audit Committee?
Yeah, likewise, Andrew. It's been through Audit Committee, and no issues or concerns with what's being proposed here. So we're very comfortable with that.
Good, that's really good to know. So can I open it up broadly to the board? Any concerns from people about what's being proposed? No, I'm sensing from the lack of hands that people are very comfortable with this. So I'm going to move then to ask, are we happy as a board to approve the scheme of delegation, the changes to the scheme of delegation? Yes, lots of nods. Yes. Good, so that is approved. Right, on to the committee updates and reports. So James, still with you. We're going to get you to quickly talk through the finance report, just the highlights. Okay.
Yeah, again, so I've already talked a little bit about next year. So you've got the report for month 8 there. The CCG is on course to deliver break even for this year. There are pressures, as we know from previous conversations around CHC, which we're working with Gloria's team to manage, and we have seen some levelling out in some of that. We're now start and in terms of the whole system, again, I think we're on course at month 9 from the preliminary figures that I saw last week to deliver break even for this year as well. There are 1 or 2 risks around ERF in terms of the impact of what the third wave, I think it is, isn't it, has had on delivery of elective activity and the income we'll get, but they're not. I don't think there'll be significant risks. So we're on course for this year. As I said in the planning element, the bit that we're now starting to work through, given the planning guidance, is the implications of having another 3 months of a CCG and then 9 months of an ICS. So that's going to mean 2 sets of accounts in 3 months, and obviously handover and all those sorts of things. So we'll work through with both the CCG and yourselves and the ICS board as it emerges in terms of how we just work those through. So we've got experience of doing this before when we've merged CCGs and changed everything. So I'm confident we can do that, but we'll work through that so that people are happy that there's an appropriate governance. And in terms of the allocations, again, I've already outlined the overall look for next year. We last week issued some draft envelopes to all the stakeholders, which they're starting to work through now. So again, that will underpin some of the planning process. So again, it's going to be a difficult financial round going into next year, but to reassure people that that process, as Jonathan has already highlighted, has already started to work through, so we can hit the timetables outlined. And I'll stop there, Andrew, just take any questions.
Thanks, James. It's a really helpful overview. So let me open it up to questions and comments. Susan, do you want to come in?
Really a comment. I'm the chair of the Primary Care Commissioning Committee, as you know, and over the last year we've seen at each meeting the main risk about primary care sitting with a recurring deficit. I just feel that obviously you talked about a lot of financial challenges moving forward, but it's going to be really important that we resolve and take action in budget setting for next year, that we build that in. You can't keep having that as a carry forward, can you? You need to make some action, really.
Yeah, so you're quite right, Susan. So that's one of the things that we're looking at in terms of just overall place funding going forward, let alone primary care, is as we move from the CCG into the ICS, how do we set place budgets, how do we take into account, as you said, some of those overspends, but equally looking at some of the health inequalities issues and targeting funds around that. So I agree with you entirely on that, and the growth, the primary care growth in terms of the new allocations for next year has been protected, so that is in the draft allocations that I've seen, so we can work through that with the primary care commissioning committee.
Thanks, James. Any other questions? No. Okay, so we've noted that. Let's go on then to the finance committee report, David, and you can just give us a view as part of that.
Thank you, Andrew. Just to follow on from the current position, and it's noted in James' report as the biggest risk has been the expenditure on continuing healthcare. So, but there's actually some signs of at least a stabilisation, if not an improvement. But we'll keep monitoring that. And there is an action plan in place that's been agreed, and we're going to bring that back to the next meeting of the Finance Committee. But that is, in a sense, the biggest risk for the CCG in the current financial year, and obviously then an impact potentially into next year's budget. Then the only other thing I'd want to note, and it's as per the report, that there are a significant number of single tender waivers that we're still looking at through the Finance Committee, and then they have to be reported into audit. That is partly still a legacy issue, because a number of contracts would have gone out to tender had we not had COVID. So there's a lot of delays on that. And also now because we're closer to the ICS, we need to look at the impacts going forward. So it is just to note there are a significant number that have been reviewed. Now they're going through a proper process. They're going through CPAG. They're coming through the Finance Committee. They're then reported to audit. So we've got a robust process, but there are a lot of these that we are dealing with. And then clearly the ones which are above the Finance Committee's limit, obviously will have to come through the governing body for sign off, and we'll do that. Thank you.
Thank you, David. Really helpful. So any other questions on finance, particularly on what's come through Finance Committee and on what David said? No? So we'll note that. Good, thank you. Let's go straight on then to the Audit Committee report. Paul.
Yeah, thanks, Andrew. So just to confirm, the last meeting we had for Audit Committee was back on the 14th of December. So just a couple of quick things to note. First of all, we had an update on the conflicts of interest system. So a new system is being procured and being implemented, and I'm not quite sure how far we are as at the end of January, but certainly for people to update their conflicts of interest on that system. So that's now in place. As per usual, the business assurance framework was brought to Audit Committee. We reviewed the risks and got some updates there. So that is a standing item and was noted. Also, the scheme of delegation, which we just talked about before, that came through Audit Committee and was approved. And likewise on the contract and procurement policy, there were a couple of minor changes due to legislation from April 2021. This largely alluded to issues around Brexit, so that was updated and approved as well. Then on external audit, I mean the main discussion there was around just preparing for year-end planning. But as people will be aware, and to emphasise, this meeting took place in December. Obviously, we've had updated guidance then on partial year accounts for the CCG in the next financial year. The approach to audit is something I will have to bring back to the next governing body, Andrew. There'll be an update from external audit about how we undertake that or what the proposals will be. Then on internal audit, we had updates on reports and substantial assurance around the financial planning process for the first half, and then ongoing updates in terms of the approach to COVID recovery and procurement and contract management. And then the final item was just the update on the readiness for transition to the system. And we review the readiness to operate statement, as people are aware, and go through that checklist. And again, obviously making good progress, but with the delay now of the CCG till 1st or the 30th of June, we will have to revisit that slightly and get the updated position on the readiness to operate. I don't foresee big issues with that, but certainly good progress is being made. That is pretty much it, Andrew, from the Audit Committee. Thanks.
Thanks, Paul. Really helpful overview. Any questions for Paul on any of that? Sarah?
Not really a question, more a comment. I think it's been raised twice now, and I think it really is one of our bigger risks around the delay, is this issue of 3 months of accounting for a CCG and then 9 months of a ICS. It's not just it's not just because we have to do annual reports and annual accounts twice. It's also about auditors' capacity, technical adjustments, all sorts of things. Doing a kind of mid-year transfer is really complicated. So I think it is worth us just putting a little bit of time, not within the governing body, but outside of the governing body, audit committee and finance committee, into really trying to understand the implications of some of that.
No, absolutely, and I mean, just to add to that, the initial views from external audit and obviously discussions with my colleagues in London Audit is this is a real concern. You know, how do you run systems like that in parallel for a part year, whether it's 3 months, 6 months? There are numerous sort of technical issues, Andrew, that we really need to understand. You know, the opening and closing balances on the systems as well. That all becomes much more complex than obviously a clean break from the year end to the first day of the new year and the 1st of April. So we need to discuss that, and I know, James, we've had a couple of conversations on this as well, and it's something that is facing all ICSs, and I guess in Southwest London, in a way, we've had the benefit of merging the 6 CCGs in the previous year. If you can imagine, there are still some organisations that have not done that, then the problems are compounded. So there's a lot to discuss there.
Thanks, Paul. Yeah, so clearly a fair bit of work to be done outside of this meeting. I recognise the complexity of that. Okay, noted. Thank you, Paul. Really helpful. Can we go on to the performance report? So, Jonathan.
Thank you, Andrew. So this is the update on constitutional standards report, to give people a flavour of where we are on that. It might feel somewhat out of date now because it covers October and November, and the reason for that is it's based on nationally published and validated information. So if I give you a few headlines from the report, but also then talk about where I think we are now and some of the challenges that we face at this point in time. So this was a fairly tricky time from an emergency care pathway point of view, though those challenges built up, as we know, through the Omicron wave through December and to January. You can see that reflected in the sort of October, November challenges around patients waiting 12 hours or more, both for physical and for mental health reasons, and some lengthy hospital handover issues. We're still doing better than most, if not all, parts of London, but not where we need to be, and a long way short of the constitutional standard requirements in that area. We, in more recent times, of course, been through the Omicron wave with particular challenges that have been well publicised nationally, and are now seeing some stability and recovery from that around the urgent emergency care pathways. In the October-November reporting period, actually planned care held up really well. We continue to make progress in long waiter reductions and increased access to diagnostic and outpatient services, delivering high volumes of activity. Again, that's been through a rather challenging period through the Omicron wave, but I'm pleased to say in the last 2 weeks we're back to the levels of business as usual activity and planned activity levels against those work streams. Cancer performance in this report looks strong and good, and amongst the best in London, or at the best in London. I would say, looking forward, I can see more challenges on the horizon. We have challenges on the breast pathway, breast screening and symptomatic pathway that's, because it's a high volume area, it's affecting our 2-week wait response times, and we have challenges on the 62-day pathway and the faster diagnostic standards that are growing. So we're used to doing very well in this area, and I'm sure we will continue to do better than many, but I am concerned about where we are at this point in time. So there's more work going in with RMP, the Cancer Alliance, in relation to that. In other areas, you can see some of the challenges around IAPT, improving access to psychological therapies, access, largely driven by workforce issues, and that's something Tonya and myself are continuing to focus on with the range of providers. And you can see progress in the SMI health check position, but not at the pace that it would be needed to secure delivery of the NHS, so that's good to know. The point I wanted to make was, whilst of course the challenges on the cancer pathway are very real in the way I've described them, there is a way in which this is really good news, because we didn't see this happen in wave 1 of Omicron. We saw referrals tumble into cancer pathways, and therefore more people presenting at a later stage for treatment, with obviously fewer treatment options as a consequence. So the fact referrals on a large number of high volume cancer pathways are above 100%, I think is a sign of success from the point of view of patients continuing to come forward for treatment. The challenge is meeting that demand. So at least I think that's worth acknowledging, because there are so many missed treatments from previous waves of the pandemic. We do not seem to be seeing that in the wave that we've just been through with Omicron, and that I think is actually a good sign, in the sense of perhaps the NHS adapting to some of the challenges that we face as we live with Omicron and whatever next variant of COVID comes along.
Thanks, Jonathan. So really good comments and discussion there, and we note the performance report. Thank you, Jonathan. And let's go straight on then to QPOC, so Quality Performance Oversight Committee. It follows on quite nicely.
Thank you, Chair. So you've got the report here. This is based on our December meeting. I'll just draw out a few things. Some of the things we've discussed today and have moved on, so I'm not going to dwell on those. We had an update from Croydon around the presentation of children and young people in the emergency departments. We'd had it for other boroughs previously, and you can see the discussion and the follow-up action that was proposed there. We also got a verbal update on the SEND reports for Kingston and Croydon, and I know that Croydon's had some a good report from the outcome of that now, and we've agreed this morning that there'll be some further South West London work around the ASD pathway and assessment and what that looks like, as that's a common theme across everywhere. The only other areas I'll bring to your attention that we haven't discussed this morning is the ongoing work that needs to be done around looked after children and initial health assessments. So we had an update, and we've asked that a process is put in place so that we can get regular updates on this, because there's more work to do in many of the boroughs. We had a good update on primary care quality and what that looks like, and you can see the areas that we discussed. And then CAMS we've talked about today, and SMI health checks. That was it. Thank you.
Thank you, Pippa. Any questions for Pippa on the QPOC report? No? Good. Okay, and we've had a good discussion about some of those issues already, as you say, Pippa. So thank you very much for that. Let's go on to the Primary Care Commissioning Committee report. Susan.
There's not much to mention. You can see from the minutes the sorts of issues we're discussing, but just to recognise that primary care, along with other parts of the system, continue to be under pressure, but working really well, and some very good examples of work that's happening in each of the boroughs. So just to note and take any questions if anybody's got any.
Good. Any questions for Susan? No, it's all fairly self-explanatory, isn't it? Thank you so much, Susan. Really helpful. And then on to the final committee report, which is Remuneration Committee, and this is a verbal one from you, David.
Yes, thank you, Andrew. So two very quick issues. One, we have discussed as a Remuneration Committee the process for the appointment of the executive directors to the ICS, and that's gone through because there's an implication for current executive directors. So that has gone through the Remuneration Committee. And secondly, there was also a recommendation relating to the salary for the chief executive of the ICS. That went through the Remuneration Committee, and to note that a recommendation went to part 2 of the board meeting this morning. That was approved by part 2 as part of our confidential business. That's all I need to report, Andrew. Thank you.
Sorry,
and you're on mute.
I got it. Thanks, David. Any questions for David about the business of the Remuneration Committee? No? Good. Okay. Well, look, that concludes all the key scheduled items for the meeting. We've got a section for public questions. We haven't received any. Are there any further questions from people who are actually participating in the meeting today? No? Okay, and I've not been notified of any other business. So on that basis, I will thank you all for your attendance and thank you for some really thoughtful questions and good discussion, I think, and people had obviously really been diligent in reading and scrutinising the papers beforehand. So thank you for your contribution to that, and thank you to those who presented as well and to all the work that goes on behind those quite comprehensive reports. So thank you, everyone. I shall now bring the meeting to a close.